I'm here today with Dr. Elizabeth DuPriest, and I am delighted to have you here with us. Welcome to the One Thing podcast.
Thanks, Adam. It's great to be here.
Yes, it is. And I know we were catching up before that. We're actually living in the same state and enjoying the same rainy weather today.
Yeah, absolutely. It's a gray Halloween day here.
Yes, and we needed the rain. So I,
Absolutely.
I think this year there's less complaining about the rain.
That's true. It's not often you see people in the Pacific Northwest being excited about the rain, but once it started, we were definitely happy for it.
Exactly. Well, I'd love to just get to know you a little bit. We've actually just met through social media, so I don't know a whole lot about each other, but I know your background. But I'd love to hear more about, sort of, your what you do and a little bit about the company you're working with and just how you got into the microbiome research world.
Yeah, so I have what I would consider a non-traditional route to where I am now. So currently, I'm the chief science officer for a femtech biotech pseudo startup company called Vaginal Biome Science. And of course, we focus on all things vaginal microbiome. So non-traditional in the sense I have a PhD in integrated biomedical science and a postdoctoral research fellowship, both from Oregon Health and Science University in Portland. And after that, I became a biology professor at a small liberal arts college in Portland and worked my way up into administration to become the dean of my division of natural sciences and health. And at some point, I realized higher ed was not my future and decided I wanted to make a transition into industry. And the job I landed in incorporates my administrative skills, but also my research background coming from a women's health perspective. I used to study what we call developmental origins of health and disease. So that's the concept that what happens to a baby while they're developing in the womb or during early childhood that programs an individual for increased risk of chronic diseases later in life. And so I studied hypertension and metabolic syndrome, but all from a maternal health kind of perspective. So that women's health perspective and my admin and my biology background kind of come together. And when I met Wendy Strigar, the founder and CEO of Vaginal Biome Science, it was a really great fit because I believe in the mission of the company. And I'm a little bit ADD sometimes, and so having exposure to a broad range of topics is always interesting to me.
Yeah.
So we get to study lots and lots of different things related to the vaginal microbiome.
That's excellent. Wow. And so your title is like clinical educator. So you're working with
Chief Science Officer is my
chief.
title.
Okay, chief science officer, and okay, but part of that is educating the public and also other healthcare providers.
Exactly. So I write newsletter content. I help put on quarterly webinars. Yeah, all sorts of educational things are part of my purview.
Excellent. So the vaginal microbiome is a topic that we hear more and more about in a lot of circles, a lot of times in the world of maternity and maternity health. Can you just give us like the broader context of how the vaginal microbiome is being viewed in health, just in all the different domains?
Sure. So the vaginal microbiome is definitely important for maternal health, but we never want to forget that it's important for women's health, regardless of reproductive status too. So when the vaginal microbiome is healthy, people never think about it. But when it's unhealthy, it causes diseases like bacterial vaginosis, aerobic vaginitis, desquamative inflammatory vaginitis, and even to some degree, yeast infections can be associated with, dysbiosis of the vaginal microbiome. And then, people are starting to learn more and more all the time about other women's health conditions that are somehow related to the vaginal microbiome, but it's a little bit less well understood. So I was just reading about endometriosis today being involved in the microbiome somehow.
Yeah, and so what are the key problems that have been identified as far as why we should really be thinking more about testing, assessing, and treating the vaginal microbiome?
Yeah, so I'll start with the maternal health perspective again.
Yeah.
So there have been a lot of studies, lots and lots of research showing that women who have a dysbiosis of some sort before pregnancy, they enter pregnancy with an increased risk of all sorts of what's the word? All sorts of conditions related to fertility, pregnancy, delivery. So for example, women just have trouble getting pregnant. They have increased rates of miscarriage. They have premature rupture of membranes. They can have preterm delivery of low birth weight babies, increased risk of chorioamnionitis, maternal infections, neonatal infections. All of those things are associated with biosis, specifically bacterial vaginosis, but also group B strep is a big one that's involved in those kinds of consequences. But even outside of the realm of pregnancy, women who have BV and other dysbioses are at increased risk for sexually transmitted infections, HIV, HPV, simplex virus, all of the chlamydia and gonorrhea also, all of the STIs, increased risk. And that has to do with how the bacteria in the vaginal microbiome are breaking down the vaginal tissue itself, making it more susceptible to infection. Yeah.
It's really interesting. Yeah, it's fascinating because I think, people who have listened to this podcast, have heard many times about the different interactions between the gut and other systems of the body. And now I guess one of the axes we look at is the gut endocrine axis. And can you talk about like anatomically, just physiologically, how that links together? I mean, I think people probably can get it conceptually, but it would be great to hear a little bit more from your view as how there's such an interface between the gut and the endocrine system.
Between the gut and the endocrine system?
Yeah.
So that's the gut. I'll be honest, the gut is a little bit outside of my purview, but what does relate in some ways, if you've heard about the Estrobolome, the way that estrogen gets recycled through the body, right?
Yeah.
So that relates a lot, and that is thought of as a connection between the gut microbiome and the vaginal microbiome to some degree, because the vaginal microbiome is so dependent on estrogen for its health. So the gut microbiome and the vaginal microbiome in some ways are connected. And so I'll talk about that because I know a little bit more about that than the gut and the endocrine system on its own. But the concept of having estrogen recycling happening in the gut, that can increase levels of estrogen throughout the body. Estrogen is important for helping the vaginal lining of the epithelium develop and mature. And as those cells mature, they produce glycogen. That glycogen, as the cells naturally slough off and die, just like skin cells, the glycogen spills out, it gets degraded and serves as food for the lactobacilli that make up a healthy vaginal microbiome. And so having that estrogen is really important for having a healthy lactobacillus colony. So for example, after menopause, women don't have that estrogen as much. And so the vaginal microbiome shifts to an unhealthier state is what it's thought to be. But at the same time, the bacteria that are in the gut, there's no matter how clean, how hygienic you are, there's some transmission of fecal microbes into the vagina. Just there is. And that's actually the basis for how some companies are making oral probiotics that are designed to support vaginal health. That's the concept there. And so the idea is that if you have some lactobacilli in the gut, that those will colonize the vagina.
Sure.
It works. It works to some degree, but really having a healthy vaginal milieu is what's really important to support vaginal microbiome health. So I know that didn't exactly answer your question.
No, it did. It added a lot to what I had never heard about. So it's fascinating. I've heard about, this issue with reuptake of estrogen from the gut and dysbiosis and maybe just sort of a Estrobolome dysregulation. And so it's fascinating because I'm hearing more and more women coming to me that are having problems getting pregnant, and they are getting the message from certain circles that they should work on cleaning up their gut as a mode of all the different things they're doing to attempt to have successful conception. And I think it's becoming more and more accepted, and there's more and more awareness that there's an interconnection.
Mm-hmm. There really is. I think cleaning up the gut is important. I also know that, and I don't know which patients you're seeing who are talking about that, but an unhealthy body mass index or body weight is also connected with infertility because of the action of leptin resistance in particular. I know that from 20 years ago in graduate school. So, the same things you do to clean up your gut are the same things that you do to improve your leptin sensitivity. And so for me, that's where my brain goes when I think about, eating healthy, for example. But at the same time, I also know that there are fertility specialists out there who, before they do intrauterine insemination or other assisted reproductive techniques, some of them are regularly sampling the endometrial biome. So this is not just the vaginal biome, but the actual endometrial biome. And if there are disruptions in that biome, they will recommend courses of action to correct the vaginal microbiome, assuming that will have ascending effects and help the endometrial microbiome to correct itself. And it seems that that improves chances of conception for many women.
Mm-hmm. Okay.
Yeah.
So let's talk about, you've talked a little bit about the components of dysregulated or dysbiotic vaginal microbiome and maybe one that's more balanced. Can we go a little bit more into that? Just, you mentioned lactobacilli. Are there other features of a healthy vaginal microbiome that you look for?
Yeah, absolutely. So, we've talked a little bit about how the gut and the vagina are like similar. They both have a microbiome, but there are actually some really big distinctions between them. So when you think about a healthy gut microbiome, you want to have a lot of diversity. You want to have a lot of different bacterial species. In the vagina, it's totally the opposite. You really want to have one dominant species, and it should be one of just a handful of different lactobacillus species. So the one that's most commonly observed is Lactobacillus, but there are a couple others, Lactobacillus Jensenii. Those are the other more common healthy species. But usually you want to have like 70, 80, 90% of your vaginal microbiome as that one single dominant species. And then that's considered a healthy microbiome. What the lactobacilli do, they're called lactobacilli in part because they produce lactic acid, metabolic waste product. So they're eating this glycogen and they're producing lactic acid as a waste, and that acidifies the vagina. So a healthy vaginal microbiome is one that creates a vaginal pH somewhere between 3.5 and 4.5. So usually we see 4 to 4.2 in that range for a healthy vaginal pH. And so that's kind of a marker of a healthy vaginal microbiome. That's really easy to do in office. You literally just use pH paper and see what the pH is. And that's a pretty good indicator, although not entirely. So that's really the special thing is you want to have one healthy species. You want to have a low pH, and that's kind of the secret sauce. And it's not that big a secret either these days. So
Yeah, but a lot of women struggle with reaching that. So it's obviously very difficult for to in certain populations or certain conditions. Or so you mentioned low estrogen states and other risk factors for these imbalances. Are there other risk factors that we should know about too, such as I'm thinking of like people who use certain beauty products or certain lifestyle habits, or maybe you can just kind of jump in on that a little bit and tell us, because other people who are more at risk for having an imbalance in the microbiome.
yeah, absolutely. And there's a lot of different things that we can talk about here. The plain answer is that all women are at risk for vaginal dysbiosis. Most women have a dysbiosis at some point in their life, whether that's BV, recurrent UTIs, which are related to vaginal dysbiosis, yeast infections. Most women have something like that. But a lot of women, healthier women, will have an episode and then they'll spring back and be healthy again. There are women who have recurrent episodes of BV over and over and over again. And so those women tend not to harbor those healthy lactobacilli. We don't know exactly why that is, but there are some risk factors. So first of all, in terms of product usage, douching is like, don't douche. Don't douche, don't douche. I can't get that message across strongly enough. There's never a reason to douche.
Okay.
So at least not from my perspective, because what douching will do is it'll wipe out any of the healthy bacteria that are there. But also, just because of the mechanical forces involved in douching, if there are bad, unhealthy bacteria, it'll push them higher up in the reproductive tract. You don't want that. So douching is just not something you want to do. Even, I've heard recently I saw a TikTok video women to douche with vinegar when they have a yeast infection, and that'll get rid of it. Well, I mean, the idea there is that it's acidic, and so it'll restore the acidity of the vagina. But it's not a good idea. Not a good idea. There are other ways to achieve what you want to do. So douching using lubricants that are hyperosmolar is a really big risk factor for BV. So the idea there is that there are a lot of vaginal products on the market that, in order to make the right texture and the right feel for these products, they're designed to have a very high concentration of glycols and other kinds of ingredients. And it's not anything toxic in particular about the molecules themselves. It's the concentration. It makes them hyperosmolar, which means they draw water out of the tissues, dehydrates those cells, kills those cells, and it makes the lining of the vaginal epithelium slough off. It kills it. That increases susceptibility to all those STIs I talked about before, and increases your risk of bacterial vaginosis, because at this point, you don't have those nice, rich glycogen-filled cells anymore to feed those lactobacilli. So that's a big risk factors, those hyperosmolar lubricants and vaginal moisturizers. But also, products like Vagisil, any kind of wash that's really harsh or that has chemicals that are going to be killing off the lactobacilli, those are things to watch out for too. I'm not saying don't use any hygiene products. I think there are some really well-designed washes on the market, but they should be gentle. They should be pH balanced. They should be osmotically balanced. So those are some things. Swimming, exercising, and sitting around in sweaty clothes, those are triggers. Even sex and menstruation can be triggers for dysbiosis for many women. Every time a woman has her period, the microbiome shifts a little bit. If you're healthy, it'll come back. If you're not healthy, it can put you into an episode of BV. So there are all sorts of triggers that women have to deal with. Some of them being natural, some of them being product-based. And then the last piece to add here is, for whatever reason, and we don't know why, studies have shown some demographic differences in terms of who's susceptible to BV and who isn't. And so in the United States, studies have shown that African American women and Hispanic women are at higher risk of BV. And studies from Africa have also shown that African women have increased risk of BV. We don't know why. We just know that these differences exist for some reason. So so it's important for women to know what their triggers are if there's someone who has repeated episodes, to try to avoid those triggers, to try to manage when those triggers happen.
Okay. Well, let's go into the testing aspect of the vaginal microbiome a little bit. So first of all, just from a big picture standpoint, can you just give us sort of the history of vaginal microbiome testing, just in a nutshell? Like, when did it first come on the scene? What did it start with, and where is it now?
Yeah, so the history is that the vaginal microbiome has been tested using microscopic methods like Nugent scoring, which is based on the Gram stain. That's been around for a very long time. I can't tell you the exact dates.
Yeah.
A very long time.
Yeah.
But Nugent scoring has its limitations. And so PCR-based methods were developed, a few decades ago. Those do a pretty good job. They have very good sensitivity and specificity in women who are symptomatic. And so, BV tests, yeast tests, trichomoniasis tests, those are all pretty good tests at this point. Clinically speaking, those are really good tests. For research purposes, PCR-based or nucleic acid tests can only test for what you know to tell it to look for. So you design a specific target. But what we're finding with bacterial vaginosis and dysbiosis in general, what we thought we knew about the microbiome from the decades of microscopy-based research is that if you can't culture a microbe in a dish, you can't study it. So there are tons and tons of species that live in the vagina that are not able to be cultured. They're fastidious microorganisms. But with recent technology, we can detect the presence of these bacteria that can't otherwise be studied. So now next generation sequencing and whole genome sequencing approaches are used to give scientists a better picture of all the bacterial species that might be present in a woman's microbiome. So those are great for research, but for clinical purposes, I'm not a huge fan of them because they overload both the patient and the clinician with extraneous information that's not really useful. Is it really helpful to know that you have 1% abundance of this obscure species that nobody knows what it does? It's probably not helpful. It's distracting. So I think that PCR-based tests are great for clinical use, but for research, I love the whole genome sequencing approaches because you can get every single nucleotide that's there. You can start to interpret function coming out of the specific genes that are being sequenced. So that's great for research.
Great. And so As far as the more targeted PCR testing that's looking for specific, I guess, more known species or actionable information, what about self-testing versus clinician testing? Can you comment on that?
Sure. So there are a few companies out there that offer direct to consumer at home vaginal microbiome testing. Actually, we're partnering with one of those companies to do the whole genome sequencing for us. It's a great technology. It does give you all that extraneous information. So if you're a consumer who just wants to know, do I have a healthy vaginal microbiome, or you're getting this list of all the microbes that you have. And the companies do a pretty good job of interpreting the information for you, I have to say. So they do try to educate the consumer pretty well. But overall, I think it's a lot of extraneous information that women don't necessarily need. But I think it can be useful, especially for women who have struggled for years and years. They can't get their vaginal microbiome, the way they want it, and they know that because they're having symptoms, right? They're having discharge or an unusual strong odor, or they're having itching, or they're having pain, or all sorts of different symptoms that women can have. And they've gone to doctor after doctor after doctor, and they can't get an answer, or they've been on antibiotics 6 times in the last year or two. I think from that perspective, getting more information about what your vaginal microbiome is can be helpful. The challenge is that, like I mentioned earlier, there are all these triggers that will disrupt your microbiome. So, you have your period, and then it takes 3 days to get back to your normal microbiome. Or you go swimming and it gets disrupted, or you have sex and it gets disrupted. Anytime you do anytime you do any microbiome test, it's a snapshot, one specific point in time. And for women, especially in their cycling years, it can change from day to day to day to day. And so your microbiome picture today might not be the same as it is next week. And so, depending on how long it takes to get your results back, those results could be informative, or they might not be. And so testing regularly, testing regularly is what seems to make most sense, but that gets expensive.
So if someone is at home and they're, sort of struggling with some of these issues we mentioned, like how would they go about using this information? Let's say they did a test. Are there steps that they can take that, I guess there's probably probiotics and things like that. I'd love to hear what some of the solutions are, because I know a lot of times when people are reaching dead ends with their provider, they might do some testing on themselves, or they might reach out to some of the opportunities that are available online, and then they bring that information to their provider, and the provider is like, I don't know how to use this data, and then they're back on their own again. What would you say to someone like that, that's kind of like in that boat?
Well, that's exactly why Vaginal Biome Science exists, to be honest, is to give agency to those women. So Vaginal Biome Science, we do a lot of clinical studies, among other things, but we test over-the-counter products to see if they can actually help prevent recurrence of BV, recurrent UT, a variety of other conditions too. And so the main product system that we test consists of a vulvar wash, an external feminine wash, an intravaginal moisturizer, and then a vaginal probiotic. And we think that, we have evidence to suggest that using this system regularly over time prevents recurrence of bacterial vaginosis. There's actually an abstract that we already have published on a small group of women that shows that we can prevent recurrence of BV that way. And so this system, is designed to help both vulvar tissue and vaginal tissue to reestablish a healthy microbiome. So it has the right pH, it has the right osmolality, it has the right lactobacillus strains, it has a mix of those healthy native vaginal strains. And it's not just a matter of using a probiotic, and this is a vaginal suppository probiotic, not an oral pill at this point. It's a combination of providing the right bacteria, but also providing the right environment so those bacteria can thrive. And so at least as long as women are using the system, it seems to be really helpful. But there are those key things to think about that I mentioned, that the pH and the osmolality need to be right. It needs to be the right strains. A lot of the products out there in terms of probiotics that you see are gut-related strains. So Lactobacillus acidophilus, for example, being the main strain. It's great for the gut. And to some degree, it can be found in healthy vaginal microbiomes, but it's not one that seems to have evolved to be a primary strain in the vagina. Looking for those crispatus, Jensenii, gasseri, those are good ones.
That seems really useful having like a system, to follow that looks at, the pathophysiology from more of a holistic perspective versus, women who struggle with recurrent vaginosis or bacterial vaginitis. They're just given antibiotic after antibiotic after antibiotic, you know, and it's like, okay, if that's not working, something's in the strategy is missing, and also the resistance to antibiotic use goes up. So it's really refreshing to hear that there's more thought that you're putting into this.
Absolutely. Like I said, we exist specifically because we know so many women who've struggled for so long this way. But it's also worth mentioning that so I've been with the company for about 16 months. That's how long the company's been in existence. And I have learned so much in that time about the education that healthcare providers get about the vaginal microbiome and vaginosis and vaginitis conditions. And it is sadly just not enough. Even gynecologists in their training are not getting enough education about how to treat vaginal conditions. It seems like because, the female reproductive tract is pretty complex, right? The ovaries, the uterus, there's so many cycles that you have to understand that interact with each other. Yeah. And the vagina just often is thought of as just a passive conduit. It's the way that semen gets in and babies get out, right? Yeah. And that's kind of all the attention that it's given. But when you think about what a big influence it has on women's health day to day, that so many women just avoid sex because it's too painful, because they have whatever symptoms going on. Women miss work because of yeast infections and UTIs and vaginal conditions. There's a huge economic burden, a physical burden of suffering that women tolerate because the only tools that doctors have to give them are antibiotics and steroids. That's kind of it. And so we're trying to move the needle on that and give women agency to take control of their own health. But the point I was trying to make in the beginning is that not all gynecologists even recognize all the nuances of the vaginal microbiome. So going to a specialist, you're likely to get someone who's going to tease out, well, you have AV, you don't have BV. Or, what you thought was a recurrent yeast infection, that's actually BV. So, women sometimes can self-diagnose, sometimes they can't, right? Because the symptoms of all these different conditions can look pretty similar. And if you've only had one of them, you don't have a comparison. It can be hard to tell what you really have. So I would say, like, if you're a woman who's had a hard time, finding a specialist, finding someone who really knows what they're talking about in terms of vaginal health can be a first step. But understanding your own microbiome through a direct-to-consumer test, I think that makes a lot of sense too.
Yeah, we're at a point where there aren't enough providers out there that do understand these nuances. Right. So and a lot of times the patients are bringing information to the providers about things that they've learned. And I personally have benefited from that from a number of my patients, is just sharing insight. And I think when selecting a provider, that's maybe even the most important thing, is to have providers that are open to learning and exploring with you versus them knowing the knowledge, because they might be informed, and say it's a gynecologist that you could help them with their learning process too. So it's not just one way.
That's true. That's absolutely true. And having a healthcare provider who's going to partner with you in whatever you're experiencing, that's almost more important than the training. But yeah. Self-training from the healthcare provider's perspective is important. So
ideally, yeah. So yeah, that is really fascinating. And I think one of the topics you hear about the vaginal microbiome that you already discussed, and I don't want to move on with the conversation without just touching upon it a little bit, is, there's this whole pressure for women who are pregnant to have, their vaginal microbiome just right for delivery. And of course, we know things don't always go as planned, and there's, a need for antibiotics and C-sections and other things that just, things aren't just always perfect with, obviously, with the delivery process. So, what would you say to someone who's extremely anxious about their vaginal microbiome and making sure that their soon-to-be delivery is, kind of goes as planned? And how does like the vaginal microbiome end up impacting the that first trimester and beyond? I'm sorry, the not the first trimester, the fourth trimester, as we call it, and beyond, when
Yeah.
the child's actually born. And
Yeah. So I did mention earlier in the podcast about, the fact that it can be harder to get pregnant. There's an increased risk for preterm delivery, low birth weight babies, maternal and neonatal infections when there is dysbiosis. But it's still important to understand that those are not all that common, right? So these are things the rates of preterm delivery are higher than we'd like them to be in the United States. And the microbiome might play a role in that, but we don't know. But the other thing, from my work, my prior work in developmental origins of health and disease, I know that maternal anxiety itself it can have effects on the baby. And so you just have to remember that you can control what you can control. The vaginal microbiome, to some extent, like I talked about some methods, some products that can be used to kind of adjust the vaginal microbiome. But, the bacteria that you have are the bacteria you have to some degree. And so you want to be as healthy as you can. You want to be eating a great diet for a lot of reasons. You want to be taking care of vaginal health. But then, we have Western medicine does great things these days. And so you trust your doctors, you trust your healthcare practitioners, you do your best, and then you try to relax. You
yeah,
try to relax and enjoy your pregnancy as much as you can, and just anticipating the fact that you're gonna give birth to this wonderful little bundle of joy, right?
yeah,
So that's kind of what I encourage. And I have known a lot of women who've had some really difficult births, and so I don't want to minimize that at all. I know there are risks associated with delivery and risks associated with everything, but like I said, you control what you can control, and then you do your best, meditate, pray, whatever it is that you do to give yourself some peace. That's what you do, in
mhm.
my perspective, which is not very well informed.
No,
But
I
yeah.
get that. I mean, I think, people also have some ability, if let's say that there is a C-section and, say there's a difference of microbiome that's being transferred to the infant, there is
Mhm.
some ability to kind of work on things while breastfeeding. And there's
Mhm.
it's not just like you have, one chance to deliver a healthy microbiome to your infant. It's like that's just
Sure.
that's just a that's just the first chance. It's pretty
Right. And
fascinating.
so, and there are a lot of women who, they have C-sections, and then they choose to do like an inoculation. Basically, they take a vaginal swab and they inoculate the baby all over with the microbes that they normally would have gotten by traveling through the birth canal.
Yeah.
There's not a lot of data on how effective that is, or we're kind of like in the Wild West, the frontier of understanding the effects of those kinds of interventions. I mean, there are studies showing that babies born by C-section have different immune activation patterns than babies born vaginally, but we don't know yet whether any kind of intervention modifies that.
Mhm.
So if it's something you want to try, I don't think there's any harm in trying it. But also, like you said, it's not, so a baby's microbiome develops over time through many, many, many exposures. Birth is one of them, breastfeeding is one of them. Picking things up off the floor and putting them in their mouths is part of it.
Yeah.
Actually, with animals is part of it. The microbiome develops and develops and develops. And yes, I definitely understand critical windows of development where you want to have that first initial exposure be the right one. But again, I think there's a big push in America in certain segments to have the most optimum health possible, and it's an unattainable goal. And the
Right.
idea is to have the best health you can to live the life you want to live.
Nice.
Right? And so
Yeah.
nobody ever has perfect health in every aspect of their body, and you have to be okay with that.
Yeah.
And once you kind of let yourself understand that none of us has a perfectly healthy body, but you live as healthy as you can, live the life you want to have, right? So I try to keep that in mind.
Yeah. It's a very healthy outlook. I always think about like, when people are planning for a wedding, it's like they have
Yeah.
this view of like how the day is gonna go, and then you
Yeah.
know a gust of wind blows the something down, and like it never goes exactly how and you just kind of roll with it, and you still appreciate the moment, you still
Exactly.
appreciate the process. At the end of the day,
Exactly.
if you have, and I think it's really healthy what you're talking about is just doing your best and trying to reduce the anxiety about the perfection aspect of it. So easier said than done, but
Exactly. Yes.
well,
Yeah, it is.
so with your work now, what are some of the projects you're currently working on, and can you tell us more about just sort of how people can work with you or work with your company? Just
Sure. Yeah, so at Vaginal Biome Science, we do R&D work trying to develop and reformulate products to make them better for women. But what I spend most of my time on is clinical studies, and it's honestly my favorite part of my job. I just was able to hire a clinical research coordinator just about a month ago, and so she's been a great addition to helping me launch and support clinical studies. And that's really how people can partner with Vaginal Biome Science, is that we're always looking for people to run clinical sites for us. Practitioners who have women who come in with recurrent genitourinary syndrome of menopause or vulvodynia, right? We're looking at all of these different things, fertility even. And so we have a study protocol. And I mentioned earlier that we're trying to understand whether shifting the microbiome using these products, a wash, a vaginal gel, and a probiotic. We know we can shift. Well, actually, we're still collecting the data on that. We can shift the vaginal microbiome. We can reduce symptoms. Can we actually make an effect on certain clinical disease states or not? We're trying to answer these questions for all those different areas I mentioned, and
Mhm.
more even. So like I mentioned, we're always looking for partners to help us set up new clinical sites. We tend to do things pretty low tech, pretty low key, with a lot of support and always on a shoestring budget. But it's what we're doing. It's pretty simple. We want to know whether a vaginal hygiene system can actually affect women's lives, right? We never want to go outside of routine care. So, if a woman comes into a study with BV, she's going to get antibiotics first, and then she's going to start the protocol. We're not at the place yet where we're telling women not to use antibiotics. I still think there's a place for those for sure, but I would love to reduce the dependence on antibiotics. That's a whole global health issue that your listeners probably know all about.
Yeah.
But yeah, so clinical studies on all any type of vulvovaginal condition, to be honest. I'm ready to launch studies on lichen sclerosis. We'd love to
Wow.
do an endometriosis study. And we're even doing a study, we're close to finishing it up in the next few months, on transgender women who've had neovaginoplasties, seeing if
Mhm.
we can help develop a neovaginal microbiome that
Hmm.
resembles a healthy cis vaginal microbiome.
Hmm.
So all sorts of different things we're working on.
Wow. Yeah. Are there any resources or books that you like people to refer people to, or anything that is sort of like more layperson oriented, that, or even hashtags to follow or websites or
I
no?
am not a social media person, so
Okay.
I can't tell you any hashtags or
Okay.
anything like that. And to be honest, my nose has been in all the journal articles. So I do think that there are so the two companies that I'm aware of that do at-home microbiome testing are Evie and Juno. I think they produce some good content. Especially Evie has been producing some good content to help women understand their vaginal microbiomes pretty well. But also, in addition to Vaginal Microbiome Science, we have a sister company, SHWI, the Sexual Health and Wellness Institute.
Hmm.
We do quarterly webinars. We have a pretty rich blog. And so shwi.org is a great website that you can go to learn all
Perfect.
about the vaginal microbiome and everything related to it.
Excellent. Yeah, and I'll put the links in the show notes for that. And that's really helpful. I think people who listen to this podcast are really into learning, and so that'll be, I'm sure,
Mhm.
really helpful for them. So, well,
Absolutely. If people have questions, I'm happy to answer questions by email, so people can reach out to me too.
Excellent. Thank you so much, Beth. So, any closing thoughts? Anything else you'd like to leave us with as a parting word?
So one thing I haven't had a chance to talk about yet is the idea about the vagina being self-cleaning. And I
Yeah.
do want to kind of address that topic because it's out there. Women read about it. Gynecologists talk about it all the time. And in my opinion, it's a little bit overdone. So the sense that the vagina is self-cleaning is accurate. If a woman has a period or she has sex, all of those fluids will come out eventually. That is true. However, the vulva is not self-cleaning. And so the vulva gets exposed to all the things that are coming out of the vagina, right? Blood, semen, also sweat, urine, feces. All of those things can be irritating to vulvar skin. They can be disruptive to the vulvar microbiome. And there's a reason that hygiene developed, right, over the course of human history. It is perfectly acceptable for a woman to engage in normal hygiene of the external tissues. That is fine, but you do want to be careful about the products you're choosing to do that. I mentioned earlier, you want them to have the right pH. You want them to be osmotically balanced. You don't want them to have harsh toxic chemicals. So that's really important, is to choose the right one. But we don't throw the baby out with the bathwater, right? So it's okay to clean yourself, and it's okay to use a product to do that. But the other thing about the vagina being self-cleaning is that there's a difference between being clean and healthy. So if you have two women, one who has a normal microbiome and one who has an unhealthy microbiome, they both have their period. They're both eventually going to have a clean vagina at the end of that. But the woman with the healthy microbiome will be healthy again, and the woman with the unhealthy microbiome will still have an unhealthy microbiome after all of that, even though the vagina is clean. And so helping to support a microbiome with some products is a good thing, even though the vagina is self-cleaning. And so I really like to draw that distinction because there is so much out there being anti-vaginal products or anti-vulvar products. And so I think it's important to take kind of a moderate approach.
It's very helpful. And, I think just even mentioning vulvar health is, I think, going to be new to people because it's kind of overlooked in a lot of ways in education and what people think about. So that is outstanding. This has been really educational and informative, and I'm sure it will help a lot of people who are listening to it. So thank you so much for all that you shared.
Absolutely. Thanks for giving me a platform to do it. I love to talk about vulvovaginal health. So anytime.
Yeah. I look forward to future conversations as you learn more and more with the research.
Absolutely. Will do.